Hey guys, I'm checking back in. It's been 4 weeks since my operation to repair my patellar tendon. So I just wanted to kind of get into what I've been doing the last week and kind of the progress I've made, any kind of weird quirks or setbacks or whatnot that I've experienced. So I did have a 4-week post-op appointment with my surgeon, and that went pretty well. I mean, pretty much I just went in there, she examined, my knee, what it looked like, and just kind of evaluated it based on feel and whatnot. We did go ahead and try to passively bend the knee on, the examining table. I got to about 60 degrees, like just a little bit short of that. So she said, okay, we're just gonna go ahead and move the brace notch to 90 degrees flexion. So in the next week, my goal is to try to get to around 90 degrees. And then the week after that, which would be, I guess, the full 6th week, I'm supposed to try to get to 110, 120, which would be almost, completely no restrictions or anything like that in terms of range of motion. These are ambitious goals, so we'll see how it goes, but that's kind of just what the framework of what she gave me was. Other than that, with that appointment, it was kind of unremarkable. I'm going to go back and see her in 2 weeks. So, and she said probably at that point I'd be more than ready to ditch the brace. So I'm looking forward to that. What else has been happening? I've been going to PT. This week I have 3 appointments. Most weeks the week before that I've been going 2 times per week. At one of my appointments this week, at my appointment this week with the first one, I just basically told my PT person that I felt like what we were doing in the sessions wasn't particularly useful to me. I mean, the first few sessions I had gone to, essentially what they were doing was just massaging my leg, doing like a laser on the wound area, and then finishing up with the E-stim. And those are all things besides the laser. Those are mostly things that I can do at home. And so I said, hey, I'm ready to be doing some more progressive things, especially in light of, and I said this in the last video, but it's very hard not to compare yourself to other people, watching their YouTube videos or reading their experiences or whatnot. And this was one where, in a lot of ways I felt like I feel like I am, ahead of where I should be, but it's hard to look at other people doing a lot more active things in their PT sessions than I have been. So I just expressed that to my therapist that was working on me that day, and she said, okay, I feel you, we're gonna get you some things to do. So she gave me a packet of exercises to do, and I've been doing them at home, and it's something good to focus on. It's something good to have in hand that I can kind of shoot for and continue to progress. Let's see. While I was at PT, she decided to try to bend it a certain way, and this is the first time that I've done this, where I laid on my stomach, and then I try to bend it myself and see how far I can go. And then the second time around, she bent it as far as she could. Now my degree of flexion was lower than when I was sitting in a chair or sitting on the doctor's table and lowering my leg that way. So it is interesting to see that you might get different degrees of flexion depending on the way that you're bending your knee. So I've just been doing that. PT, I've been doing a lot of stuff at home when I can, trying to strengthen the hip, the ankle, the calf. My leg is so much smaller than the other one. It is very weird to see, and it is like, this is not normal. However, most of the people that I've talked to that have had kind of major knee surgeries, eventually they said that the strength and the size in your leg comes back very quickly once you actually are able to start doing strength exercises. So I'm probably you know, a week or two off from basically my PT therapist told me that it's best to be able to have full range of motion, or at least as close to it as possible, before you start trying to do leg strengthening, like you know, try to put mass back on the leg. So that's, you know, what I'm still shooting for right now. Let's see what else. Walking has gotten easier. You know, I've been off crutches since my 2nd week mark, and it's just gotten a little bit easier and a little bit easier. Driving is getting a little bit easier. The only thing with driving is, and so my left leg is the one that's affected, that I had surgery on, but you know, getting into the car is kind of a production. However, that's getting easier. I just kind of take my my brace and put the, you know, unlock it essentially, so that however much I need to bend to be able to drive, I can do that. I'm still eating very well and being careful with what I eat. A lot of vegetables, a lot of fruit, high protein, high quality protein stuff. Still taking my supplements that I think are helping, and yeah, I think that's half the battle, is a lot of, you know, what you put into your body and what you try to you know, nourish yourself with, I think is really important. Let's see what else. I am going to kind of just show you a couple of the exercises that they sent me home with from PT. I mean, it's nothing major, it's nothing crazy. It's just kind of things that I think if you see, you'll be like, oh, well, you know, I can do those, and I don't think they're very major at all. Other than that, I go back to my surgeon in 2 weeks at the 6-week mark. I've been working from home this entire time since I got injured through my surgery and all that. So I will be actually going back into my office next week. So I'm really looking forward to that, being able to get out of the house and not just, you know, have to sit on the couch pretty much the entire day. I go anywhere I want really right now, even though, you know, it is more difficult to get around and, you know, whatnot. I think it's important that you get out of the house and you know, be able to celebrate those victories. I did get my temporary handicap placard, and that will be good for, I think, 3 more months. So I have 3 months of that to look forward to, and it comes in handy, very much so. Other than that, I'm just going to kind of show you a couple of the exercises that I was sent home with, as well as kind of what I've been doing at the gym. I did go back to the gym about 2.5 weeks post-surgery, just kind of trying to do whatever I can until I'm able to, you know, do more complete movements with my legs assisting. Other than that, I will check back in if I have like another major milestone, or if there's something that I feel like is newsworthy. But other than that, I'm just going to keep working at this and try to get my leg back up and running as soon as possible.